You're muted, Dr. Riley.
And I'm just talking. Hey there, hi there, ho there. Welcome, everyone, to our Wednesday webinar. We're glad that you're here. Welcome. I'm Dr. Carolyn Rowley, the Executive Director and founder here at Cayenne Wellness Center. And so I want to bring on right now Dr. Michelle Wang at City of Hope. And so we're glad that you're actually here. So, um, wow. Gene therapy. But before that, let me just say that we're glad that you guys are here. Those of you who follow Cayenne Wellness Center, you know that we bring all kinds of different education to you, whether it's on gene therapy, modifying therapies. We do have an upcoming 17th annual Sickle Cell Disease Educational Summit coming up. So, you all, if you have not registered to come to San Jose, now, should I sing the song? The Dionne Warwick song, Do You Know the Way to San Jose? Come on. We want you all there. We're expecting you. So that's what's coming up. But with gene therapy, as you all know, a couple years back, December 8th, that was a pivotal day that we had two FDA approved gene therapies. And so our goal has always been to collaborate and partner, get the word out and educate. So I'm just really happy that Dr. Wang from City of Hope reached out to us saying, can we do something? And I'm like, of course we can. So I'm going to turn it over to Dr. Wang. So make sure that you're hydrated. Get some notes, get paper, pen. Um, there's something for everyone today, whether you're a warrior, whether you're a caregiver, whether you're a healthcare provider, social worker, just to be able to hear the experiences of those who have gone through, who are post, or even just to find out what is gene therapy? How does that even work? Sit back for the next couple of hours to learn. We're glad that you're here. If you see someone who's not on, you may want to give them the link real quick and say, hey, you may want to join us right now. And so I'm thankful that you're here. I'm going to turn it over to Dr. Wang. Thanks, Dr. Wang, for collaborating and putting this on together.
Absolutely. And thank you so much, Dr. Rowley, for even giving me the time and the platform to share about gene therapy. So for everyone here on the call, my name is Michelle Wang. I am a pediatric bone marrow transplant doctor. I also see patients who do gene therapy at City of Hope in Duarte, California. And, as Dr. Rowley was mentioning, now that gene therapy has been FDA approved for over a year and a half, I feel like word is really spreading about it. People have had more time to think about it. And I wanted to go through what you would want to consider if you're thinking about gene therapy, if it's the right path for you. Today will be a little bit different from the prior gene therapy webinars from 2023, particularly because Dr. Rowley's amazing team has put together an all-star panel of sickle cell warriors who have gone through the gene therapy process themselves or as a family member, and they're here to share their personal stories with you. I think it's a really incredible opportunity to hear from people who've actually done this themselves. And it's actually something that many of my own patients ask me all the time. So let's get started. So first, some disclosures and some disclaimers. First, I have no conflicts of interest. I do work with both companies that manufacture the FDA-approved gene therapies for sickle cell disease patients as a part of my job at City of Hope, but neither company is paying me to do this talk. And as a disclaimer, I see patients at City of Hope who are interested in gene therapy, but unless I've personally seen you, you should get your own medical advice by seeing a physician yourself. If you are interested in gene therapy after this talk, I strongly recommend that you seek out a physician at a gene therapy treatment center to see if it's right for you and to make sure that you qualify. So these are the topics that we are planning to cover. I'll go over what gene therapy is. We'll walk down the long road and the many steps to get through gene therapy. And then I'll talk about who is eligible for gene therapy and a lot of the things that we take into consideration and a lot of things that we ask patients to think about themselves. And then we will have our excellent time with our panelists for some discussion and lots of questions. So first, what is gene therapy? To talk about gene therapy for patients with sickle cell disease, we really do have to take a step back and remember, where does your blood come from? We all have blood-forming stem cells or hematopoietic stem cells that live on the insides of our bones, here in the bone marrow. I think that these blood-forming stem cells are amazing, and that's why I'm in this job, because they can make every single kind of blood cell that your body needs. These include platelets, which help you stop bleeding and form blood clots. They include red cells that carry oxygen to every part of your body, and then your white blood cells, which form your defense mechanisms with your immune system. So I like to think of the bone marrow really as a bone marrow factory because it's producing all of the blood cells that your body needs. To talk about gene therapy, we need to do a little refresher on what DNA is and what genes are. So I think of DNA as the instructions to make a protein, kind of like a recipe. So in people who don't have sickle cell disease or other blood problems, they have this DNA recipe or instructions to make hemoglobin, which is this pink and purple protein that is in your red blood cells. And they have healthy red blood cells that carry oxygen to all parts of your body. For people who have sickle cell disease, that DNA recipe gets changed. If you're a baker, you would think about this as baking soda getting changed to baking powder. And if, it's just one word difference, but if you've accidentally ever done this while you're baking, you will know that the end result is very, very different. And so the hemoglobin product is changed and the red blood cells are sickled. They get stuck in blood vessels and they just don't carry oxygen very well. So unfortunately, I can't change the DNA recipes as easily as using an eraser. Currently approved technologies for gene therapy don't have a way of erasing the mutation, but they use very different strategies to make more normal, non-sickling red blood cells. And one thing to note is that the gene therapies that I'm talking about today only correct the blood-forming cells. They don't change the DNA in the rest of your body or in your organs, like your heart or your kidneys, or in your eggs or your sperm. So you probably know that if you have hemoglobin SS disease, then any biological children that you have will at least carry the sickle cell trait. And that will not change if you undergo gene therapy. So going back to the types of gene therapy, there are two gene therapy products that are approved for sickle cell disease. One of them is called Lyfgenia, the other one is called Casgevy. I will show you how Lyfgenia works first. So just reviewing again, the DNA are the instructions, they make a product, you have healthy red blood cells. This is what we have in sickle cell disease. What Lyfgenia does is it actually adds in instructions for a special kind of hemoglobin here in the blue. This hemoglobin does not sickle. And so the bone marrow factory will make more of the different hemoglobin and less of the sickle hemoglobin. And that means that more of the red blood cells in your blood vessels don't have the sickle hemoglobin. So it's kind of like somebody who has sickle cell trait. These are the groundbreaking results from their clinical trial that led to FDA approval. Here on the y-axis is the median hemoglobin level of participants in the clinical trial. Most sickle cell patients on the trial had a hemoglobin somewhere between 8 and 9. Starting at 3 months after they got their gene therapy, which is here on the x-axis, not only does the median hemoglobin increase to 11 or 12 or even up to 13, but over 40 to 50% here in red is that special non-sickling hemoglobin. And then their sickle hemoglobin levels, which are here in green, are reduced to about 50%. And we also know that around 80% of all of the red blood cells that they make produce this special non-sickling hemoglobin. And so those 80% of the red cells don't sickle and they don't cause problems. And we can see that here in this table. So here in the table, each row is a different patient who participated in the clinical trial. On the left here in the blue is the 2 years before they started the study. And each dot represents a vaso-occlusive crisis. The severe ones are in blue, and the non-severe ones are in orange. And you can see that in those 2 years before they started this study, patients had a lot of pain crises with a median of 4 every year. And then in yellow is what their time looked like after they got the Lyfgenia infusion, which is pretty much none. One thing that I do want to bring up is that patients who had daily or chronic pain were not included on either of the studies. In my personal experience, what I can share is that I've seen patients with chronic pain improve after gene therapy, but it does take time. The other FDA-approved gene therapy is called Casgevy, and it makes completely different DNA changes. So here, you'll need to remember that as babies, we all make some fetal hemoglobin, which is this purple and blue hemoglobin. And even though we all have the DNA to be making fetal hemoglobin and adult hemoglobin, the fetal hemoglobin production is considered unlocked as a baby. And so this is why we don't see many symptoms of sickle cell disease in really young babies, because they're making enough of the fetal hemoglobin to outweigh the amount of sickle hemoglobin that their bodies are making. As the babies get older, you can imagine that the fetal hemoglobin production is locked, and so only sickle hemoglobin is made, and only sickle red blood cells are around. What Casgevy does is it unlocks the production of fetal hemoglobin again, so that your body is making more fetal hemoglobin than sickle hemoglobin, and there's more non-sickling red blood cells that have the fetal hemoglobin than the sickling ones. So these are the results that they published from their clinical trial that again resulted in the FDA approvals. Here on the blue line, you can see a really, really nice increase in the fetal hemoglobin starting about 2 months after they get their gene therapy, and it stabilizes at around 4 months. And the total hemoglobin in their bodies also increases to about 12. There ends up being about 90% of red blood cells that express the fetal hemoglobin and therefore aren't at risk of sickling and causing trouble. And this table similarly shows on the gray side is the 2 years before they started the clinical trial, the purple dots being pain crises that required hospitalization. And you see a lot of purple dots on the gray side and almost none on the green side, which is after they got the Casgevy. So both of these studies resulted, as Dr. Rowley mentioned, December 8th was a big day with the FDA approval for both of these gene therapies for patients with sickle cell disease. And, this FDA approval means that gene therapy for sickle cell disease is no longer limited to only being in clinical trials. So the next question is, where can you get gene therapy? Unfortunately, it's not at just any doctor's office, and not even every hematologist or blood doctor would be able to offer it. So both companies that make the Lyfgenia and the Casgevy have very strict rules about what a hospital needs to be able to do in order to provide the gene therapy. So the centers have to go through a very extensive application process to become designated treatment centers for each product. I'm going to show you a map of the qualified treatment centers for Lyfgenia. For those of you who don't know where Duarte is, we're just east of downtown Los Angeles. And so I put the City of Hope sign there. If you had noticed a number 5 there, it means that if you zoomed in into the Southern California area, there's actually 5 centers that offer Lyfgenia. And so, as much as I would really love for all of you who are interested in gene therapy to come down to City of Hope and see me, I do want to make you all aware that there are other centers in Southern California, and you should consider doing some shopping around. Maybe one center is closer to where your support system is based. Maybe one center can get you in a little bit sooner. Or maybe the people that you meet at one center, you like them better. Another consideration is what insurance you have and where are they contracted with, as that may also limit your choices in terms of which hospitals you can go to. If you're in another big city like New York or Chicago, there are also more than 1 or 2 centers in the area. And so I do encourage you to just explore those options. This is a map of the treatment centers that are authorized to offer Casgevy. And you can see that many of the same centers are offering Casgevy as well. And again, depending on your location, in multiple parts of the country, there are lots of centers that are offering it, so at least look around. It does become tough if you don't live near a center, because then what you would want to do is make sure that your insurance covers gene therapy first, and then if so, figure out where are they contracted with, and then you'll have to sort out how you're going to get there and where you can stay. So to just summarize the first couple of slides, gene therapy makes changes to DNA in order to treat diseases. The sickle cell gene therapies that I'm talking about today make changes to DNA in only the blood-forming stem cells. And only specialized centers currently offer sickle cell gene therapy. So now we'll go through all of the steps on the very long road to get through gene therapy. This is a pretty busy picture, but it shows you all of the steps of gene therapy. And you can see it's a pretty long and winding road, and we'll go through each step. So the first step is exactly what you guys are doing today, which is learning and getting as much information as possible about gene therapy. Getting like a big picture of what the whole process looks like the last slide, and then maybe hearing some of the not so pleasant details about the process. For some people, hearing the not so pleasant details is enough to make up your minds against it. And for some people, hearing about it is really scary, but you might not want your disease to keep affecting your bodies, or you don't want to be in the hospital all the time for pain crises. And so you might be willing to go forward with the next step, which is talking with a hematologist. I would hope that all sickle cell warriors have a good hematologist that they can see for regular check-ins. Most hematologists will have a decent idea of who will qualify for gene therapy. And if you have a long-term relationship with them, they may even be able to tell you what they think will be the hardest parts for you and maybe how you could prepare for them. But I do recognize that some of you may not have hematologists, and your primary care physicians may not know a whole lot about gene therapy, but they can look into it. And if this is your situation, then I would, be prepared to advocate for yourself, especially if you think you should qualify. So the next step is getting a referral and then being evaluated at a treatment center. The time for this really varies. It can be maybe even as soon as the week after you get a referral if they have an opening, or it could be a few months later, depending really on when you can get in. The evaluation can take one visit where you do a whole bunch of tests, or it might take several visits to really get everything done. As I'll mention later, you have to have severe enough symptoms of sickle cell disease to qualify for gene therapy, but you also need to be in overall pretty good health to qualify. So the treatment center will ask you about your symptoms of sickle cell disease, and then they'll have you do blood tests, they'll do imaging tests to see how healthy you are, and really just overall make sure it's safe for you to undergo this process. This is also when we make sure that your insurance will cover the gene therapy. Now, once you and the team at the treatment center have decided to pursue gene therapy, we schedule a date for your first stem cell collection. It's probably going to be a couple of months after your first appointment. So for instance, if you come to see me and you commit to this process right now, we're scheduling patients for collection dates mostly in December to January. Once you have that date, you'll have to start getting either simple transfusions or red blood cell exchanges to decrease the percent of red blood cells that are sickling in your body. This helps calm down your bone marrow so that it's not all revved up, thinking that it needs to make more red blood cells. You will also have to stop your sickle cell medications, such as hydroxyurea or Endari, and that's because we don't know how those medications might affect the stem cell collection. So you'll have to do a red cell exchange 2 months before, then 1 month before, and then the day or a couple of days right before you collect your stem cells. For stem cell collection, it's usually a couple of days in the hospital where you're hooked up to this machine. It takes your blood out, it spins it all down, and then it takes out the layer of cells where your stem cells are. And it returns everything else back to you. You will need to have a central line placed for this. Most centers won't use a port to collect stem cells, even if you have one. So the central line can be either temporary or it can be more permanent, really depending on what you and your team decide works best. At the end of every stem cell day collection, the stem cell lab will count how many stem cells we collected. Each product, the Lyfgenia or the Casgevy, has a different target goal number of stem cells that we're trying to collect. We always hope that we'll be able to collect all of the target cells in just one cycle, but for many sickle cell warriors, it takes more than one cycle. So you come in again and again, and potentially up to 4 or more cycles until we know that we've gotten enough stem cells. And what that looks like is you collect the stem cells, you are able to go home and rest for 4 to 6 weeks. Then you come back, we do it again, and really we keep doing that again until we know that this company has gotten enough. 1 day of the collection is used to collect backup stem cells in case of a very rare complication that's called graft failure. We don't send these stem cells to the company to make gene therapy. We keep them in our freezer in case your gene therapy cells don't work. We've not seen this happen in any patients on the clinical trials or after the gene therapies have been commercially approved, but it is a theoretical risk, and so this is how we address it. To produce the gene therapy, it takes the gene therapy companies about 3 to 4 months, or sometimes more, to do testing to make sure that the gene therapy cells don't have any infections that could get you sick, and to make sure that they do what they say they'll do, which is make blood cells. And during this time, we basically sit and hang tight. Most patients will continue to do their monthly simple transfusions or exchange transfusions to keep their sickle cell disease from flaring up and also to keep their bone marrows really quiet and healthy. As I will mention later, one of the potential side effects of the chemotherapy that's needed for gene therapy is infertility. The chemotherapy can stop your body from producing enough sperm or eggs to make a baby. And so there is a chance that you won't be able to have a biological child afterwards. There are newer ways to try to preserve fertility, and there is actually some coverage available for patients who qualify. So if you actually live in one of the states here in blue and you have Medicaid as your primary insurance option, there's a program to help. And if you don't have Medicaid and you have commercial insurance, both of the companies have a program that can help, but again, it depends on your state. So now I'll go through what the hospital stay looks like. I made this calendar just to make it a visual. So first is the chemotherapy, which lasts for 4 days. Then 2 days of rest, just hanging out in the hospital. A star for cell day, because it's a big, exciting day. And then really about a week of feeling pretty okay, maybe some nausea. But then 2 weeks of it being pretty tough, and then taking between 1 to 3 weeks to recovery. Now I'll go through sort of each step. So a reminder of that visual, we're talking about the chemotherapy, which is on the top in orange. So if you think back to my analogy of the bone marrow as a factory that makes all of the blood cells, all of the equipment in the factory is making sickled red blood cells. So we need to use chemotherapy to basically blow it all up and then start from scratch. I do not intend to sugarcoat this, but this is a really long and tough hospital admission, and most of that is because of side effects from the chemotherapy. These include pretty much everything that you've either seen on TV or maybe seen someone that you know struggle with if they've gotten chemotherapy. On the left-hand side are short-term side effects that are almost certain to happen. These include nausea and vomiting, diarrhea, hair loss, which is temporary, but it does take some months to come back. Because we are wiping out your blood-forming factory, you will have low blood cell counts. So you'll have low red blood cells, you'll have low platelets, and you'll need to get transfusions of those. You'll also have low immunity because your white blood cell count will be very low. And so that puts you at risk for some very significant infections. We also have to talk about the mouth pain or the mucositis that happens because of the chemotherapy. Basically, the top layer of all of the cells in your mouth and your throat all the way down through your gut is very vulnerable to chemotherapy. And so after the chemo, those cells all die for a short period of time before they come back. And before they come back, it's very uncomfortable because your mouth and your throat and your gut are raw and they have ulcers and it hurts a lot. So most patients end up needing IV pain medication. Most patients end up needing IV supplemental nutrition because it's almost impossible to eat or drink. But that's why you are here in the hospital, so we can help, keep you safe and keep your nutrition adequate. I have had many patients tell me that the pain during a transplant or gene therapy is the worst they've experienced and worse than any pain crises that they've ever had. But these are short-term, they're while you're in the hospital, and the symptoms get pretty bad for those 2 to 3 weeks, but they do get better. On the right-hand side are possible long-term side effects that we monitor for really for the rest of your life after you've gotten gene therapy. These include things like cataracts that affect your eyes, low hormone levels such as your thyroid hormone or your sex hormones. It can cause heart failure, meaning your heart muscle gets weaker and doesn't squeeze as well as it should. The chemotherapy can be associated with something called lung fibrosis. So I think of the lungs as like a balloon that inflates and deflates and is very flexible and elastic. Fibrosis is when you have a scar in your lung, and so it's not as flexible and not as stretchy, and air can't get through as well. there is an increased risk of a second cancer that can happen 5 or 7 or 10 or 20 years after getting chemotherapy. And so it's really important to make sure that you have good medical care in the years afterwards. We do also follow patients to monitor their kidney function, since you can have chronic kidney disease after sickle cell disease and after gene therapy or bone marrow transplant. And as I mentioned, infertility is a significant risk after gene therapy. And so we strongly recommend people who are interested in having biological children afterwards to consider what their options are for fertility preservation. In the clinical trials for the two products, there was one death related to COVID-19 in a patient who already had lung problems from their sickle cell disease. And so, because of how intense the chemotherapy is and the low immunity that happens, I do, need to share with you that, yes, there is a risk of dying from going through the gene therapy process. But if you look at it statistically, you are actually probably more likely to die from being in a car accident than to die from complications with gene therapy. Now, moving on from those 4 days of chemotherapy, cell day, which is that star on the top right, you at that point probably have some nausea, but hopefully not too many other side effects. And we're giving you, medicines to help your nausea. You will get pre-meds, so things like Tylenol or Benadryl to prevent an allergic reaction to your cells. And then you get your gene therapy cells through your central line. It's not a surgery to receive the cells. It's actually just like a blood cell transfusion, but the stem cells are super purified, so they're clear and they're not red like red blood cells or yellow like platelets. And this is actually a picture of the infusion of our very first Casgevy recipient. Now, talking about the recovery period and what's going to happen after the gene therapy cells are infused. Like I said, those 2 to 3 weeks after your gene therapy infusion are pretty tough, especially with the mouth pain. Usually by the end of the 3rd week, we start to see that your gene therapy cells have made a home in your bone marrow and the new equipment is starting to settle in. And we can actually see new blood cells from your gene therapy cells starting to be made. And so at that point, we will start weaning you off of your IV pain medications and your IV nutrition. And we talk about when we can send you out of the hospital. When you're out of the hospital, we expect to see that your symptoms are continuing to improve. And we'll see you very frequently in the beginning in clinic to make sure things are going okay and that your labs all look okay and that you're feeling relatively well. But those clinic visits will decrease in frequency as we get further and further out. We will check your immune system to see how it's doing in terms of regenerating itself. And usually at the 6-month or 1-year mark, we'll also check for antibodies to the childhood vaccines that you all should have received. We're not sure yet. We think that some patients may retain some of their immunity to the vaccines from childhood, but if you don't, and if we don't see antibodies to those diseases, then you will need to be revaccinated to keep you safe. And then long-term, the FDA requires us to follow all patients who have received gene therapy for at least 15 years. But I would expect that this is going to extend to really lifetime because all of those potential long-term side effects could happen anytime after the chemotherapy. And so, yes, the follow-up care will be 15 years, but I would expect for it to be longer. So to summarize the second section, the road to gene therapy is long and definitely hard. There are definitely many bumps in the road to gene therapy. I talked about very common acute side effects, but there are more rare side effects that I didn't have the time to go into. But just acknowledging that there are many potential short and long-term side effects that are related mostly to the chemotherapy for gene therapy. So now, we know what gene therapy is, and we know how long the road to get through gene therapy is. And now we'll talk about who is eligible. Now, to be clear, I'm only talking about eligibility for the FDA-approved commercially available gene therapies. I'm not going to be talking about eligibility for any clinical trials because those may have different requirements. And, like I mentioned, as I'm not your gene therapy doctor, sometimes the criteria that I'm talking about may be more strictly followed at one center or a little bit more loosely followed. So I really encourage you to, seek out your own appointment and find out. So under the umbrella of sickle cell disease, only a couple of types of sickle cell disease qualify for gene therapy at this time. And those two are sickle cell anemia or hemoglobin SS and sickle beta thalassemia. Unfortunately, patients with hemoglobin SC, SD, SO, or SE do not currently qualify for gene therapy. There's also a very narrow window of eligibility. So you have to be sick enough, but otherwise everything else has to be healthy so that you can tolerate the intense chemotherapy. And I illustrate this here with these two triangles. So in blue is your overall health. So you could be great and you're not having any problems at all. You don't have to see specialists. You just see someone maybe once or twice a year. But on the other end of that spectrum, you could have very poor health, where you have many problems, you see many physicians, you're on many medications. Opposite that is, how severe is your sickle cell disease? You could say it's not very severe, it doesn't really bother me every day. Or you might be in the boat of, it's very severe, it affects me every day. Every minute is affected by sickle cell disease. This green bar represents sort of this narrow window of being eligible, where your sickle cell disease is severe enough, but everything else is healthy. So currently, the eligibility criteria for the commercially available gene therapy products for sickle cell disease are, on average, having at least 2 pain crises, which can include acute chest or priapism or splenic sequestration every year for the last 2 years. We also are only able to offer sickle cell gene therapy to kids or adults who are over 12 years old. The clinical trials for kids under 12 years old are still ongoing, and so we're still waiting for that data to come out and waiting for the FDA to be able to approve it. In general, patients can't have previously had strokes or other blood vessel issues in their brains, and they have to have good heart, lung, and kidney function. So if you are a person who needs a lot of oxygen day in, day out, or if you are a person who needs dialysis, the likelihood is that you may not qualify for gene therapy. You also have to have a healthy liver. And for those of you who have received a lot of transfusions, we need to know that you don't have iron overload in your organs and that you've managed your iron by taking the chelation medicine. And finally, because of the risks of infection, we need to know that you don't have any current, active, ongoing infections. We will ask a social worker to sit down with you to talk through some other concerns and plans that we hope that you can make. So for example, we're going to ask who's going to be in the hospital room with you, either during those collection cycles or when you're in the hospital for those 5 to 7 weeks. Who do you want to spend that much time with in a room? And who would you find helpful and supportive to be with you during that really hard time? Thinking about who's going to be able to bring you to appointments, because there will be a lot of appointments before and after you receive your gene therapy. You will be on many medications after the gene therapy, many of them to prevent infection for up to or even more than a year. And so hopefully there is someone who can keep you accountable to protecting your health. If you are a provider for your family and you have to be away, you will want to consider who can help your family while you're in the hospital. And then financially thinking about, are you able to take this much time to be off of your work? And at the same time, thinking about whoever you're going to ask to be in the hospital with you or bringing you to appointments, is your caregiver going to be able to take off that much time from work too? We also encourage you to think about your life after gene therapy. For most patients, a lot of time is freed up now that you're not going in for frequent transfusions or pain crises. And so we ask you to start making plans. Are you going to start a new school program, or are you going to consider a job or trying to get a promotion at your current work? Will you take up any new hobbies? What kind of relationships right now are very valuable to, and what kind of relationships are you hoping to maintain and build after your gene therapy? And another important question is, who is your community, and how will you feel after you've gotten your gene therapy? And another important question to think about is, what will you need for health insurance after you've gone through gene therapy? Will you need to be added to your parents' insurance if you still qualify? Will you need to have a job? Will you need to make regular health appointments to keep qualifying for the insurance you have? These are all things to take into consideration. And usually these are all things that we talk about at our appointments when you're thinking about gene therapy. I would also definitely advocate that you bring your planned support person or people to the appointments, or have them call in so that they can help you process the information, and they can maybe even help take notes for you. All right, so I'm just wrapping up and coming back to the title of my talk, Is Gene Therapy Right for Me? Questions really to ask yourself are, is it the right time? Now, a lot of people will say there's no such thing as the right time, but what I mean is, thinking about what other things might be going on in your life. For instance, if you just moved and are just getting settled in and you don't even have a hematologist yet, maybe not. Or thinking about, do you have the support that you need? Do you have caregivers that you know that you can rely on? And do you have the financial resources right now to be able to undergo gene therapy? Then thinking about, what's your current health status? Can you identify organs that don't work as well because of your sickle cell disease? And is it clear that it's getting worse? And then, hearing about the risks of gene therapy, do you accept those risks? Right now, if it doesn't sound like it's the right time, if you're young, there probably is time to wait. We do know that as you get older, it's harder and harder to collect enough stem cells to make the gene therapies. And we also know that as you get older, sickle cell disease takes more of a toll on your organs. So, my recommendation would be that if you're in your 30s, especially your upper 30s, now is probably the time to consider it. But that said, there might be new technologies and other ways to do gene therapy, or even, new curative treatments out there in the future. So keep your eyes and ears peeled. I have no doubt that Dr. Rowley and Kion Wellness will share that news when things come out. I did want to share a few resources with you before I finish. First, the NIH has a pretty nice website to educate people with sickle cell disease on gene therapy. Then these two QR codes link you to the maps of the treatment centers that I showed you for Casgevy and for Lyfgenia. From there, you'll be on their websites. You can actually reach out to their patient support programs, and they can help you figure out if your insurance covers gene therapy. So my last slide, both companies do have pretty good patient support programs, which can be really valuable if you qualify. So they can offer additional education about gene therapy. They do just general check-ins and see how you're doing and support you through the long steps. They can offer travel or lodging assistance, again, if you qualify financially, where they can help pay for gas, they can help pay if you have to take a plane to get to a treatment center, and they can also help pay for hotel stays if you need to stay at a hotel in order to get to the treatment center. And as I mentioned, fertility preservation support really varies state by state and whether or not you have Medicaid. So it's really worth finding out more information from both companies individually because they can provide for collection and storage to preserve fertility. All right. That is all for me for now. I really want to thank Kind Wellness, Dr. Rowley, and all of the panelists who have really generously agreed to participate in today's amazing event. Thank you all for your time. And now I'm going to hand it off to Dr. Rowley and the wonderful Wunmi Bakare.
Don't leave yet because we actually have questions. So we have a few questions that Joy's going to put up. So
okay. Yes. So I'm just going to read it off. Is there a reason that patients with chronic or daily pain were excluded? I would think that they are the ones you would want to study the most to see if the gene therapy was successful, if their pain was better. Absolutely. I was not involved in designing the studies, but I believe the rationale was that it would be hard to separate out acute pain crises versus chronic pain after getting gene therapy. And so it would be much clearer to see the outcome of not having acute pain crises if they didn't have this underlying baseline pain every day.
And Stephanie has a question, if you want to read that one.
Okay, Stephanie's question is, does hemoglobin created by Lyfgenia increase fetal hemoglobin at all, or does it use a completely different hemoglobin? So that's a great question. The hemoglobin for Lyfgenia is completely different from fetal hemoglobin. So if we were to measure your fetal hemoglobin levels after getting Lyfgenia, it generally does not affect those levels at all. But it makes a completely different hemoglobin, and so the percentage of sickle cell hemoglobin goes down. Stephanie's question, are there incentives provided to the hematologists or the primary care physicians given by the companies to entice doctors to invest their time or money in education needed to do the referrals? No, I don't think that there is. Mostly, I think there are laws regulating that kind of stuff. Definitely, like as a physician myself, we try to reach out as much as we can to all of our referring providers and make them all aware that we're offering gene therapy. And, doing these kinds of outreach events, I actually, shared the link with many of our referrers as well, again, to really increase awareness. But yes, as far as I know, the companies are not allowed to incentivize education. Oh, okay. Why was the selection on the two genotypes? So yes, the hemoglobin SS and the S beta thal was selected instead of all types. That's a good question as well. So the probable answer for that is that those two are the most common, SS and S beta thal, and so it would be most likely to be recruiting patients who have either SS or S beta thal. And to keep things basically simplified in terms of not introducing other factors that may affect the outcomes. I think that's why they chose just the SS and the S beta thal. I've definitely, for what it's worth, been pushing the companies to do studies for patients with other genotypes. And so, there are still discussions about that. Will Ronald McDonald House accept people for this? So at City of Hope, because we are an adult, actually, mostly an adult cancer center, we don't have a Ronald McDonald House, but I believe Ronald McDonald Houses are usually at pediatric hospitals, and I would say that most pediatric hospitals would accept people for this. So to arrange for those patients, after the long hospital admission, to be able to stay at the Ronald McDonald for their follow-up in clinic, definitely yes. I would be surprised if they didn't. So I think it's is the 2 annual reported crises or make a break for acceptance, even if you are on regular or several medicines to prevent crisis and in your late 40s. So I guess there'd be 2 factors there. One, your age. At least from what I hear from other centers, I would say most centers are not considering, for now, patients who are over 40. And again, that's because we know it's really hard to get stem cells from patients who have sickle cell disease in general, and with age, that difficulty really increases. And then the second reason for that 40 age limit is because we know that the organ damage from sickle cell disease accumulates with age, and by the time you are in your upper 30s to 40s, usually there may be reasons why the chemotherapy would do a lot of harm for you. Now, addressing the 2 annual reported crises being a make or break if you're already on medications to prevent those crises, it is an ongoing, I don't want to say debate because there's no debate about it, but even the companies themselves recognize that we are, in a sense, penalizing people who actually have very good control of their sickle cell disease if they're, for instance, getting chronic transfusions so that they don't have crises, or like you, if they're taking multiple medications and only that is allowing them to live a reasonable quality of life, but that disqualifies you from this life-changing therapy. But unfortunately, yes, as of now, the criteria do not allow for, even if it's because you're taking medicines.
And yes, that's definitely a catch-22 because the FDA-approved modifying therapies have been around much longer than the 2 FDA-approved gene therapies. So at least for these 2, no.
Yeah.
But like you stated, there are clinical trials taking place. And so I think it's worth looking into what that criteria might be, or those criteria for those clinical trials. And so, again, I'm very hopeful, and I'm an optimist. And even for Lyfgenia and Casgevy, their clinical trials and FDA approval is different.
Absolutely.
And so that's why I think it's worth looking into the clinical trials. There is a way to do it. You have to be a little savvy, but there's clinicaltrials.gov. But I think that if you want some assistance, just let us know, and we may be able to share that. One thing I can't share is that at our summit, we always have on Industry Day, which is September 17th, we always have both FDA approved therapies, but also the pipeline clinical trials. So you might, again, another reason for coming out, being able to listen and hear about what they're doing and speaking to the person to get more information, because going through the clinical trials and those criteria are different than the final FDA approval.
Absolutely. Absolutely.
I think we have time for just a couple more questions. So I thank you, Joy.
So, with the issue of fertility, is it an established fact that gene therapy affects fertility, or is fertility collection just a precaution? So, for one thing, I would want to clarify that it's not the gene therapy cells themselves that affect fertility. It's the chemotherapy that's needed to undergo gene therapy that affects your risk of infertility. And I would say it's not like 100%. There's no way you can have biological children naturally after undergoing chemotherapy. It's just that risk increases significantly by probably at least 50% chance that you won't be able to have biological children naturally. And so, with that sort of at least 50% chance of not being able to, that's why we really encourage patients to look for options on fertility preservation.
I do, before you state this question, there is also SC-RED, which is Tiana Wolford's organization. And so I would highly recommend, and I'll look for the link as well, and I could put that in the comments as well. So that's also a very good resource as well regarding fertility and sickle cell disease and this whole experience.
Absolutely. From Stephanie, warriors often have to do so much education of your medical staff. Oh yeah. Sometimes we get pushback because many of us don't have medical training. Is there any certification process we could get on this? Good question. I really do wish you could just hand them a card and say, look, here's the information, or look, I attended this and I do actually know what I'm talking about. Unfortunately, there is no certification process. So for clarity, do you think a certification program exists that would indicate that we're trained in the ability to speak to staff on gene therapies, and would that make it a more efficient process? I think that probably the best thing to do would be to say, look, I went to a webinar put on by a physician with gene therapy, and then I heard all of these panelists who have actually gone through the gene therapy themselves, who shared their lived experience with me. If you don't believe me, you can look it up on the website, or reach out to Dr. Wang at City of Hope.
I was going to jump in here and say that one of the initiatives that I'm currently working on is to kind of develop a patient-provider toolkit. And so I will be completely transparent. I work in the cell and gene therapy space, not facet of sickle cell disease, and you're constantly learning. Both providers and patients. You might have embarked on the journey yourself, but no two warrior stories are exactly alike. And so there's constant learning. So even though as much as I love the idea of a certification program, the science will continue to evolve. And as it evolves, we need to evolve with it. But also the patient experience will continue to evolve, because currently we have ages 12 through, your late 30s. But the reality is, if this continues to be the treatment option of the future, then there would need to be modifications and revisions to the content. And so even though you might be informed, you might not be able to fully understand the facets of that windy road in that picture that Dr. Wang shared with us, that kind of details each of those processes. There are other gaps that exist within that journey. And so I think it's hard but we are working on it. And I know I do a lot of work with providers to, again, figure out how do we have these conversations with providers who are seeing patients in clinic, because they should be your first step in having these conversations outside of these kind of town hall setups where we're able to kind of share the provider and the patient perspective. But yes, I wanted to just touch on that. But Stephanie, really great questions so far. And so with that, I'm going to pivot. Thank you, Dr. Wang. Your
Thank you.
presentation was robust, but also you covered it brilliantly. You are a provider who you really show you care, because I love that you touched on the psychosocial aspects, the eligibility criteria, recovery and monitoring. You really took us through the length and breadth of conversations around gene therapy specifically. And with that, I'm going to pass things off to our 4 fantastic panelists. But let me back up a little bit. I didn't introduce myself. And so for those of you who do not know, my name is Wumi Bakare. I am the host of a podcast called Through the Genes that highlights the risks, the benefits, the limitations of cell and gene-based therapies. We're in season 2. You can find us on www.throughthegenes.com or anywhere you get your audio-visual content. But primary to that, I am also a sickle cell warrior diagnosed with HBSS who has embarked on the journey of transformative therapies. I am 5 years post-stem cell transplant. But with me today, we have a powerhouse of patients as well as a caregiver advocate who are going to walk us through each of the facets that Dr. Wang highlighted and give you a little insight into what the patient and the caregiver journey is like for all of the stages of gene therapy. So I would like to introduce our elite set of panelists, Valerie Hayes, who is a gene therapy recipient. She's going to talk us through the pre-process, everything from eligibility criteria to her decision to embark on the gene therapy protocol. Then we're also going to meet Yomi Ajenuke, who is going to walk us through the during process of gene therapy, everything from her fertility preservation journey to her day 0. And for those of us that are on the other side of transformative therapy, day 0 is your infusion day. It's the day you get your new cells, edited cells, transfused into your body. So Yomi will walk us through that process. And then to close things out, we have the fabulous Taylor John, who is also a 9-month gene therapy recipient. She will talk us through kind of the post-facet of the gene therapy process. And then, of course, we have Ray Blaylark, who is a fantastic caregiver advocate and the mother to a warrior who received his gene therapy, I want to say 8 to 9 months, Ray, if I'm not mistaken. Or
1 year and 1 month.
Okay. So as you can see, we brought in patients that highlight different aspects of the journey so that all of your questions from how did you decide to embark on this journey to what is life like on the other side of gene therapy, we can cater to all of your needs. And so with that, I want to kick things off to Valerie to give us a little intro about the pre-journey to gene therapy.
Thank you, Wumi, and thank you, Dr. Rowley and Dr. Wong, for this opportunity to share. My name is Valerie Haynes. My story is a bit different. I was diagnosed with sickle beta plus thalassemia when I was 26, and it was life-changing for me. I had the opportunity to live a somewhat normal life up until around my late 20s. And that's when I was really, really pushing to be diagnosed and figure out what was going on, why I was having pain crises, and why I felt like there were certain things in my body that just weren't operating right. And it wasn't until I lost my eyesight for a day, and I decided to go to the eye doctor and figure out, okay, is this just a normal eyesight thing, or what's going on? And come to find out, he said, look, I only see retinal retinopathy in patients who either have diabetes or sickle cell. So we're going to need you to go to a hematologist. And I said, wait a minute, I only have the trait. I only have the trait. My mom said I have the trait. But it really turned out that I had sickle beta plus thalassemia, and all things made sense at that point. And I was fortunate enough to have a hematologist who planted the seed of gene therapy when I want to say maybe 2.5 years ago. And we were just talking about it, actually. It seemed so far-fetched at the time. And it felt like a lot of work, because she was saying, hey, I know a doctor that does gene therapy, and you're a good candidate for it. You have the support. You are at high risk of having a stroke because of your retinopathy. And because of your organ damage, I really do encourage you to think about lifelong transformative therapies. And in those 2 years after, things started to escalate. I ended up having a complicated pregnancy. And even post pregnancy, things just continued to get more heightened with my crises, and with my kidneys and things like that. It wasn't until I went to Morocco, and I felt like I had the nerve to go to Morocco knowing that I had sickle cell, but it was a trip that I always wanted to take. But I ended up having a sickle cell crisis for that entire trip. I want to say I maybe had a day where I was able to explore. I made the most out of that day, but it was probably one of the darkest crises that I've had, because I almost had to go to a hospital in Marrakesh, but also that I felt like I didn't know where the rest of my life would go. I was a mother, I'm a mother, a wife, and I want to travel. I want to, take my son places. I want to be on the soccer field if he wants to play soccer, or whatever sport he wants to play. And I felt like there was no controlling it. There's nothing I can do, and this is not the life that I want to live. With sickle cell, with pain, with the risk of stroke, and continued organ damage and things like that. So it was an eye opener. As I was sitting in that hotel in Morocco, I was really thinking about my life, and where I wanted to see it moving forward. So when I got home, I remember heading to work and feeling like, well, um, what is it that I can do to make a change? And I started thinking about gene therapy, and I started like visions flashed before my eyes of me going through this process, because I had heard about all those different steps that Dr. Wang went through. And I remember a voice saying, it's going to be hard, but do it anyway. It'll be scary, but do it anyway. And I felt like that was God talking to me. My faith is a big part of, how I've faced this illness. And so I started reaching out to doctors on the train. And before I got off the train, I had responses. And I reached out to my hematologist, and I asked if I was able to, speak with her doctor, or the doctor that she recommended. And sure enough, I ended up having an appointment, and one thing led to another. And I was getting my ports placed. I was in the process of getting my exchanges and setting up to do my collections. And a few things that I wish I was told about the collection process, and the Okay. I may have been lost for a second, but here I am. I hope you can hear me. Um, but it is hard on your body, and I ended up having very low iron. So I started off being okay with my iron, and I ended up having iron deficiency, which led to me having POTS, which is postural orthostatic tachycardia. which made it a bit hard for me to stand up or walk or do anything without my heart rate going up. But I was blessed to have doctors who were listening to me, and I just continued to advocate for myself, and they were able to, help me through that process and get the iron transfusions that I needed and all of that. And what I will say is I am now 3 weeks out of the hospital after my transplant. I'm a month out from receiving my transplant, and I would do it again. I feel amazing. I feel strong. And it is really a blessing to be where I am today and as strong as I feel today. So, yeah, that is my story. I'm happy to answer any questions that you may have.
Valerie, thank you for starting us off. I think the perspective you offered was so important, but also empowering, of that like fearless warrior journey and wanting to find solutions and wanting a better quality of life, which I think is why many of us embark on this journey. Yummy. So I'm going to pass things off to you. Also, congratulations on being 3 weeks. Thanks. Welcome to sisterhood. And so, Yummy, I'll let you kick things off and kind of talk us through your journey and the during process of gene therapy.
Hello, everyone. My name is Yomi Ajeneye. I was diagnosed at birth with sickle cell type SS. During the hospital, I had a lot of preparations I needed to do. I work full time, so I had to put in FMLA. Another thing I did was short-term disability, so I could get at least a portion of my pay. I had to make sure that my bills all lined up correctly. I had to make sure, my house was in order, cars were in order. Something that really helped me is that I did my gene therapy local to me. So I'm in Tennessee, so I did mine in my city. And it also helped that my parents were in my city too. So they were really my support and backbone throughout the entire process, and especially when I entered the hospital. So my caregiver was my mother. She is also a registered nurse, which helped a lot. And first week, so I got admitted on a Monday. So my process was actually in March. So I got admitted March 10th, Monday. We didn't do anything that day. It was just, taking my stuff, made the bed, put my snacks where I need to put my snacks, and just chill out for the rest of the day. I also brought my Fire Stick, so I had Netflix, Hulu, all the apps just to watch throughout the entire stay. That Tuesday, the next day, I started chemo, 8 a.m. sharp. So the chemotherapy that was given to me is busulfan. I had it for 4 days. It was every 6 hours. It ran for every 6 hours for 2 hours. So the first dose was 8 a.m. on that Tuesday. My last dose was 2 a.m. that Saturday morning because of the every 6 hour thing. That time was kind of boring. I was kind of nauseous. It does cause a lot of nausea. I was very sleepy, especially that Wednesday until the Saturday. I really didn't do much. I was hooked up with I had my Trifusion central line. I had just the chemo and of course the saline, the hydration going. I don't think I really needed pain medication during that time, but I did have round the clock nausea medicine given to me because it really did cause me a lot of nausea. After that, I had my 2 days of rest, which my 2 days of rest was that Sunday and then that Monday. And then the following Tuesday, which also happened to be my birthday, March 18th, I got my edited cells. So that day I call the most eventful, non-eventful day ever. My transplant time was supposed to be 11 a.m., but the doctor was running late. So it ended up being 1 p.m. And from 1 p.m. until 1:20, that was all it took. So my cells were in 3 little vials, and they defrosted them in water, and then put it into a syringe, and just one by one, just inserted it into my central line, and that was it. Like, it was like, wow, like just 20 minutes, that's all it took. I'm cured. Like, what? So it was eventful because I had everybody in my room. My family was there. Of course, all the nurses, the coordinators, the doctors, everybody was there. And I was trying not to cry, but I started to cry. My mom started, my family started to cry. Everybody was crying. So after that, I just kind of told everybody to, like, go home. I'm fine. Everything was good. And from that moment, I got to be unhooked from the machine. So from Tuesday until, I want to say, about Friday, nothing was going on. I was walking around free, just no IV pole, just doing whatever I wanted to do. Then the mucositis came. So mucositis is the lining from your mouth all the way down your digestive tract, basically slots off, and it's raw. I maybe Friday, Saturday to Sunday, I was still able to drink. I couldn't really eat anymore. That Monday, it was a lot. It was very painful. They had this suction thing, like in the dentist offices, when they put water in your mouth and to suction the water. I had that because I couldn't swallow my spit anymore. I was drinking Ensures the first 3 days, and then I couldn't drink anything at all. It burned, everything burned. They put me on a PCA pump, and because I couldn't eat anymore, I was put on TPN, which is total parenteral nutrition, that went through my central line. And it was like that for about 10 days. I want to say about 10 days I was hooked up to the PCA pump and the TPN, and I had to get platelet transfusions. I had to get blood transfusions. But they were still monitoring me and making sure that, my neutrophil count goes down to 0, my white blood count goes down to 0, and the rest of the levels stay, at least normal. So after that time, things started to get better very quickly. And about another 10 days, I was out of the hospital after my counts went back up, and after my chemo symptoms kind of resolved. And that was the 37 days that I spent in the hospital. That's what it kind of included. So
Yummy, thank you for that. It's very interesting. During the process, it can feel underwhelming, but incredibly emotional, because you recognize that you are kind of mourning a life you once had, and now evolving into another side of your lived experience of, getting your cells, and slowly but surely your body is recovering, but then the chemo effects are starting to kind of like impugn. All right, Taylor, you're gonna wrap it up for us and really highlight, as you can see, I want to, it's very important for me to say this. Valerie and Yummy look fantastic. Because obviously we've all been through different facets of the chemo journey. When your skin darkens, you lose your hair. And Taylor is rocking a very short pixie, which should let you know that she's a couple months out. But all right, please take it away and share with us kind of what that post transfusion day was like for you.
Awesome. Thank you so much, Rumi. And yes, my name is Taylor, you all, and I'm going to tell you about my post-transplant journey. As you all can see, I have my teeny weeny afro showing out today. I am 9 months post-transplant for gene therapy. And just in this 9 months, my life has changed drastically. I remember when I first got home from the hospital from doing my transplant, we stayed in a hotel. And I remember I walked outside with a halter top on and just a light sweater, and I didn't go into crisis. And that was the first time I remember being like, oh my goodness, 6 months ago, I would not have been able to do this without going into a pain crisis or without feeling some sort of pain. But here I am. I just had my transplant. It's not even 2 months later yet. And I can already go outside in extreme weather conditions, something that would have been detrimental to me before, and it's having no effect on me. So that was the first inkling in my mind. They're like, okay, wait, this might actually be working. And since then, I have tested my limits to no end. I've been going on solo trips. I was able to go to a sickle cell conference in Orlando about 2 weeks ago. I flew down by myself. I was able to, get my room and just travel alone, because before I would always be worried about in the back of my mind, oh, what if I get sick? Or what if something happens and I need to be admitted to a hospital and there's no one with me? These doctors don't know me. Just a whole new set of doors have been opened in my life. I've gotten back into school. So I'm in school to be a medical assistant now. And I love that. I loved school growing up, but I could just never be there because I was always admitted to the hospital. So that was a huge chunk of my life that had just been taken away from me involuntarily. And now to just gain that back, it's so amazing. I was speaking with one person at the Sickle Cell Convention last week, and I was just telling her about what my plans were and what I was excited to do. And she stopped and she looked at me and she said, I can really tell you're enjoying your freedom. And at that moment, it really clicked to me how much I had just been so excited and just to do something that people take for granted, something that everyday people who don't have a chronic illness would just be like, oh, that's just a regular Tuesday for me. For example, walking through Hartsfield-Jackson Airport in Atlanta, that airport is huge. And I would never be able to walk that distance because I have 2 hip replacements, and it would always cause some type of pain. So I would need a wheelchair service. So to go from having to do a wheelchair service through Hartsfield-Jackson to being able to walk on my own 2 feet throughout that entire airport and not feel pain and not feel like I'm slowing down, speed walking at that, not even just like slowly dragging. I was speed walking through the airport. Little things like that really make an imprint on my heart to be like, Taylor, you made the correct decision for your life. My eyes are super, super white. I can look in the mirror every day and it almost mesmerizes me how clear and bright they are. Because before, my eyes would be as yellow as a Lay's potato chip bag, just from all the cells breaking down constantly. But my eyes haven't been yellow one single day since my transplant. I'm able to go back to school. I'm currently almost done with school, so I can go ahead and get a job in the medical field and just work in the field to give back in some way and sort of help the community the way that the community helped me. So being a part of the medical field is definitely a dream of mine, and I'm making them come true one day at a time. Being able to meet most of my sickle cell friends who I might not have met in person, now I can meet them. Now we can hang out and go do things together. And it's not just, oh, I talked to this person, on the other side of a computer. Being able to actually make plans and hold them and actually follow through with them is huge for me, because you don't want people to think that, oh, you were just flaky or you're always canceling. No, I really had a chronic illness that would literally be debilitating, where I could not follow through with things I wanted to do so much. So now having that freedom, having that joy of actually feeling like an adult, feeling like a 30-year-old woman who can make her own decisions and travel the world, I'm so excited for that. I really, really am. So I've also noticed that I went swimming for the first time as well. Always getting into a pool would cause me to have a horrible pain crisis in my legs, where I would be immobile, not able to walk for a week or 2 at a time. It's literally been maybe a decade since I've been inside of a body of water, whether that's a hot tub or a pool. And 2 weeks ago, I was able to get in a pool with no adverse side effects, no sickle cell crisis, nothing. So if I had to do this all over again For me, I would do it in a heartbeat. Mucositis and all, I would take it all over again because it literally changed my entire life and flipped it 180 degrees. And I'm not going to stop running with this ball that I have. And I can't wait to advocate for others in the sickle cell community. And my thing was with the transplant, I wasn't as afraid to do it. So I wanted to go through the process and then come back and tell my sickle cell family how it was for me. Because it's hard to just hear doctors and you hear the scientific words, you hear them explain it in science terms, but until you can look at someone and see your reflection in them, or you can see yourself in another person, and you can look at them and be like, okay, this person is telling me the truth. I know they've actually dealt with the things that I deal with from sickle cell anemia. And she got it and she's okay. And she looks great. And now she's telling me about all the wonderful things she's doing in her life. That's why I did this. I want to be able to touch so many other lives and be like, your life doesn't have to end with sickle cell. You can take the wheel and change the trajectory of your course. It's possible. And I've been able to make new friends like Rumi and Valerie and Yomi. And I hope to make many, many more in the future as well. So thank you for having me. And I'll answer any questions if you all have any.
That was such a heartwarming recap of your post, because for me, it's exciting. It's exciting to listen and see how beautiful your life has become, how full, how much freedom you have, and kind of making plans and keeping up with those plans. So thank you so much, Taylor, for sharing that. Yeah, I want to echo some of the things that the warriors that have come before me have said, which is, yes, gene therapy and transplant may seem scary, and at different facets of that journey, it probably will be. But I think at the heart of a lot of warrior stories is just wanting an improved quality of life, of living pain-free, of being able to make plans. And I really think that this list and panel of exceptional warriors are really painting a clear picture for you to fully understand that, like, it isn't a linear journey. There are highs, there are some lows. But I think if you can survive sickle cell disease and the complications and the symptoms that come with sickle cell, then this is something you can equally kind of navigate and get through as well. With that, I would like to pivot to Ray Blaylark, who is a caregiver of a warrior, to kind of highlight the caregiver experience and what that encompasses from the pre to the post of watching your warrior navigate gene therapy.
So thank you very much for having me. It's very exciting to be able to come and represent really caregivers who are in the position to walk alongside their warrior. I worked in pediatrics for many years, and so many of my experiences come from that perspective. But I also have an adult warrior, and my son actually just turned 29. So the month before he turned 28 is when he started his journey. But I need to back up probably about 3 years, because we have had the conversations and discussions about the fact that gene therapy was coming. Bone marrow transplant was not an option for him because he did not have any siblings, and our search had really not ended with any promising results. So we decided to wait on the gene therapy for a better result. Ultimately, my job as a caregiver to an adult warrior was to allow him to know what my perspective was, but leave more than enough room for him to make his own decision on what he felt was best for him moving into his future. We have a very close relationship. He lives next door to me, not with me. But he went back and forth. He wavered. We had many conversations and discussions. Not every conversation and discussion started well or ended well, but it was important that we had them. And ultimately, when the decision was made, he made that decision not because mom wanted him to, but because he found the things that were most meaningful to him in creating his why. And that was important for me because first and foremost, most of us warrior moms have very strong personalities because we're fighting for our kids, right? We want them to have the best outcomes. We want them to have a future. And that can, in fact, feel overwhelming to a warrior who is at the age of making their own decisions. And they may feel a sense of pressure around that and not wanting to disappoint. One of the things that I had to be very careful to address was, I don't want you to feel like you have to do this for me. I don't want you feeling like, because I feel like this would be a great choice for you, that's the decision that you should make. This has to be your decision and your journey. I may be a contributing factor, but I didn't want to be the only reason that he chose that. And then through the process, I was there to help him talk through all of the various feelings that he had. This was indeed a roller coaster ride. Even living with sickle cell disease, he had a roller coaster of emotions. Mental health, from anxiety to depression, was ever present from the time he was very young. So, it was important to me to create safe spaces along the way. There were points that he changed his mind after he signed the paper, and he had every right to do that. But I wanted to make sure that the reason that he was changing his mind was not due to just fear, that he was able to talk through whatever that fear was and then come back to the table and make the decision that's right for him. And each time we did that, he was able to return to center and chose to move forward. During that process, there were those difficult days that he didn't want to push. There was a particular day that stands out to me that I asked the doctors, because I saw his mental health declining, I saw the struggle, and I said, can you give us one day? And that had to do with, exercising and keeping those muscles good and making sure that he didn't get any atrophy. And so it was important that not only was I there to support him, but I was also still advocating for him when I was able to be in that space. And then after we came home, my job obviously was to support him. It was to encourage him to stay safe, to wear a mask, even when he didn't want to. Sometimes he did, and sometimes he didn't. But it was for me to support him and to remind him that no matter what decision you make, whether I agree with your decision or not, I'm going to love you. I'm going to support you. I'm going to be here for you. And that is the ultimate gift that I gained. But the other piece that I will say for any caregivers that may be listening to this now or in the future, allow yourself to be on a journey as well. The journey that your child has, the journey that you all have together, and the journey that you have to take alone. You never return to what you were before you had a child with sickle cell disease. It's not picking up where you left off. It's starting anew. So thank you so much for allowing me the space to be able to talk about it.
And I will preface by saying Ray is all of our mothers. She is a mother to a warrior, but in the community, she's also a mother. She's been a mother and a friend to me. And I think, thank you for highlighting the aspect of being a caregiver to a warrior, because oftentimes I find my mom struggling with her identity as well. I've cared for you your whole life with this disease, that now she's finding her interests, because for so long she's devoted all of her time to me. And I think it's a beautiful relationship, because now I get to care for her in the way she's cared for me. It's a common thread with all of these warrior stories. I think almost everyone mentioned either their mom being their caregiver or a spouse being their caregiver. And I really want to highlight the importance of kind of the fabric of Black and Brown families, of like our parents and our faith being kind of a foundational piece of why we are able to kind of persevere through these protocols.
Yeah, I absolutely recommend that, you choose your person. If you don't have a parent or you don't have a family member that's, walking with you on this journey, find your person, because you just need someone to bounce off of. You just need someone other than, hospital staff to be looking at, those conversations that remind you of your humanity, and that the next day is coming and the sun will shine again. Every now and then you just simply need that. And even as physicians and providers try to provide that for you to a great extent, there's nothing like having someone who looks like you, who shares life experiences with you, and who can relate to you outside of your diagnosis.
Love that. So with that, we're going to open it up for questions. I do want to highlight one question that I saw that I can't answer, but Dr. Wang can offer more context, which is, what is the cost of gene therapy? Gene therapy, the protocol offered by Vertex Pharmaceutical is priced at $2.2 million, and the treatment offered by Lyfgenia, which is Bluebird Bio, is $3.1 million. But again, in as overwhelming as those numbers sound, one of the things Dr. Wang highlighted is the ability for there to be organizations and resources to help with costs along the way. And there is no one size fits all approach to embarking on this journey. I can speak for self. I'm Nigerian, born and raised. My transplant was paid for by the NIH through a clinical trial. And so I didn't incur any of the costs, the added weighted heavy cost affiliated with this treatment. And I'm grateful for it. But I think what I want to encourage patients, especially because we have some international patients and caregivers on this call currently, is that talk to people who have been through it, who can provide some type of guidance for you in figuring out a way for this to be made possible for you. But with that, Joy, I'll let you kind of kick us off and so we can kind of talk through the questions one at a time. Okay. If you don't have questions, I have questions for the panelists. So I'm happy to start things off. Let me just scheme through really quickly to make sure I'm not missing any obvious questions. And I do not think I am. Oh, there is one, Brianna. All right, so the question reads, is gene therapy less risky than bone marrow transplant? I can touch on this question, but I would really love to bring Dr. Wang up to kind of highlight as well. From the conversations I've had with providers, the difference is with gene therapy, they're modifying your own cells. So there is not a risk of graft versus host disease. In my case, as a transplant recipient, my donor was my adult brother. And so there were times during my initial 3 to 6 months of recovery where there was nervousness around my chimerism level. And if I was developing leukemia, or if I was developing graft versus host disease, because I started to have sores on different parts of my body, and the team was worried that could this be graft versus host disease. So I don't know if it's so much less risky as because you're using your own cells, the providers don't have to worry about the complications that could present because you're having donor cells being infused.
Yeah, absolutely. Wumi, you really don't mean me. But I was going to say that for the last question too. You also fielded that question perfectly. But yes, so thinking about the differences between gene therapy and bone marrow transplant, I think the key difference in terms of risk is that there is no risk of graft versus host disease after gene therapy because those blood-forming stem cells and that immune system is coming from yourself. And so there's no risk that that immune system will try to attack itself. The other risks that I talked about, mostly related to the chemotherapy, they're about the same as for a transplant.
Okay, so I'm going to ask a question to Valerie, Taylor, and Yomi, which is, we have highlighted the important aspect of the protocol, but I don't think we've talked about the psychosocial impact of this treatment on our individual mental health. And we had an offline conversation yesterday, but I would like to bring that forward. So can each of you ladies kindly walk us through the process of decision-making and where you are now in your recovery journey, and how are you doing when it comes to your mental health?
I can
Taylor,
start.
Okay.
Oh,
go ahead.
I can go first since I'm the furthest along. So my mental health journey, I would say I started from the very beginning of the process on my mental health journey, because I can remember once I applied, I had to wait maybe 3 months to figure out if I would get accepted while they went through my medical records. And even during that time, I remember texting my mom like, Mommy, I think we need to find me a therapist, because if they say no, I don't know how I'm going to take that. Like, I need to just have that prepared just in case. because this was, to me, my one shot. And if my one shot would have been a no, that would have broken my heart entirely when I had already gotten it built up enough to even put my foot out there and try to apply. So then throughout the entire process of doing collections, and then you have to wait the waiting period to see if you have enough cells, and they come back, okay, it's not enough, you got to go again. It was just a lot of back and forth. You get your hopes up, you wait, you get your hopes up, you wait to see if you can move on to the next point. So one of the things that I did was create a playlist of gospel songs that I like to help me get through, and I titled it Self-Care. So whenever those feelings started coming up, I would put on my self-care album, I would put my beats on, and I would just go to like tunnel vision. Like, Taylor, you got this. God has brought you this far. He's not going to leave you. And then that got me through the transplant. Every day during transplant, I would take out a prayer card. I would have my scripture for that day, and I would write a song on it, a song that was embodying what I felt that day, and I would stick it on my wall. So I needed to see my family around me. I needed to see my why. So I had pictures up on the wall, just visual things that could let me know your family's here. You're not alone. This doesn't look like a hospital. We've decorated to make it look like your room as much as possible. Things like that helped me immensely. And now being home, I still have those same pictures up on the wall. I still have that same playlist. So these are things that not only helped me through transplant, but that I'll most likely take throughout the rest of my entire life as well.
Love that.
And getting back to the sickle cell community helped me as well. Going to the sickle cell conference and meeting other warriors who've been through gene therapy, finding that community, that helped as well. And I've made friends with Val and Yomi offline, and now we are like sisters for real. So just finding people who understand what you're going through is very pivotal for me.
Love that. Valerie, did you want to add anything? Or sorry, Yami, go ahead.
So for me, I was at a very low point when I found out about the gene therapy. So my specific doctor, he's been doing gene therapy since, he's actually the first one to do it on the very first patient in my city that I've lived in my entire life, and I knew nothing. So when my dad was watching the news, and as he always does, and he said, wait, this is the hospital that's doing this, doctor. He gave me the phone number. At that point, I already kind of made it in my head that I didn't want to be here. So it took me a while to even call. I didn't call for weeks. That was actually December of 23 when, the FDA approval came and everything. And I had to think about, Yomi, you don't want to end your life. At that point, I was 25. 25 is not it. Like, this is not all that is in store for you. There's more. And I had to keep telling myself that. And that's what pushed me to finally call. That's what pushed me to go to the first appointment meeting him with my mom. And then pushed me to get my medical records from the medical center that essentially neglected me at that point. And then getting my, oh yeah, you're good to go. Like, you're accepted, let's get it. And it was like a very quick process, because from January until March of last year, it was like a quick turnaround from, okay, I had my first appointment, to, oh, you're into the gene therapy, you're in the trial. Come on, let's go. Let's get your central line. Let's start you on your collections and your apheresis. Let's go. So I really couldn't process it like quick enough that I went from, I don't want to be here, to now like, oh, I'm going to be here longer now because now I'm in the trial. And it was too much for my brain to handle. So I immediately had to enroll myself in therapy. I even took it as far as taking psychiatric medicine, because it was like I had an up and down. I had highs where I'm like, yes, I'm going to be alive longer than what my current age is. And I had moments where I'm like, am I sure that I want this? I think there's somebody that's more deserving than me. Like, I think there's somebody that, a young person that's probably like 18, 19, 20, who could probably do more than I can do. Like, so I had a lot of highs and lows. during when I finally entered the hospital and during the starting of the chemo and stuff, I met somebody who did the gene therapy 5 years ago, and I met him literally at the right day at the right time because I was terrified when I entered the hospital because it's like, what if this doesn't work? What if I'm like that? What if I'm that 1%? What if this doesn't work for some reason? And when I talked to him and when he told me what he was able to do, going from debilitating sickle cell disease to living all this life, that's what I needed. Like my entire 37 days in the hospital was a breeze because I kept thinking about what he said to me on that day, that I was able to do A, B, C, D, E, F, G, and continuing to do more stuff. And then after, when I got discharged and I was in the hotel, I had like a high, and then I crashed around like June when I got out of the hotel, and it was like, okay, go back home. You can go to work whenever you want to go back to work. And I was like, are you sure? Like I could do what these other people can do now. So I had to restart therapy. I had to figure out some other stuff. And then on top of that, I was going through another hard thing in my life that has nothing to do with health reasons. But now I've kind of like found my footing after being like 4 months post. Like I feel like I'm okay. I'm having more good days than bad. It's now like 80-20 instead of like 50-50, or even before transplant where I was like, I don't want to do this anymore. So
Right.
I think been increasing.
Yeah, I think thank you for sharing that, because I always say this to people when I share my stories. Like, I told God I don't want to live past 30 in sickle cell. And I found out 4 days before 30th birthday that my brother was in. So I think I love that you highlighted that, because oftentimes in communities of color, we don't highlight mental health. And the throes of sickle cell can feel all-consuming. So I just ask that you be kind to yourself and be gentle with yourself, because even on the other side, there are new feelings about to be unlocked. And in those moments when that happens, please heavily remember that you have family who have walked the journey, so you don't have to feel alone in your process of recovery as well. But yeah, thank you for highlighting that. There was another question I wanted to quickly see if we could take. I believe it was Brianna, the age limit question, which I will pass off to Dr. Wang. I can answer this, but I'll let Dr. Wang answer.
So the question is there an age limit for bone marrow transplant? And I would say that in general, it's probably about the same as for gene therapy, only because, again, we know that with age, the organ toxicities from sickle cell disease tend to add up and accumulate, and it makes it very challenging to tolerate all of the difficulties with the chemotherapy. That said, like I said at the very beginning, I am not your medical provider. And so I really strongly recommend, if you are interested in bone marrow transplant, to talk to your primary care physician or your hematologist and ask for a referral, and really, be seen at a center that offers bone marrow transplants to get that answer for yourself.
I believe all the questions we've had so far.
Can I address one of the questions that I saw after Dr. Wang?
Go ahead.
Yeah. Stephanie had asked about, do the caregivers go through any type of assessment? And so I was curious about what you all do at your institution. And given my work through the CBO here in Minnesota, we are part of the psychosocial team on both our transplant team as well as the pediatric clinic. And one of the things that we are pushing for is a psychosocial assessment, not necessarily through the psychologist at the institute, but there should be some sort of an assessment for not just readiness, but also what are the needs that you anticipate? How can we incorporate that into the community-based organizations, programs, and services so that we can be proactive and not have to wait until there's a situation? And so there's many, psychosocial issues are so broad and so many things that you don't even think you're bringing with you into that journey that you do. And so it's really important that it's established that there is a community that is willing to walk with you, not just a clinical team.
Yeah, no, thank you so much, Ray. So as a mostly pediatric facing person, I would say that our psychosocial assessments usually are mostly focused on the family aspect of it, and figuring out who the caregiver, and then speaking with the caregiver usually. On our sort of young adult side of things, being perfectly honest, I'm pretty sure that our team's assessment is only with the young adult themselves, and we don't necessarily include the caregivers unless the patient themselves, brings up the caregiver. Then we absolutely invite them to take part. But I think we usually just sort of take the patient's word that the caregiver is in on this and understands sort of all of the weight of this. I think absolutely, knowing that there are other families and other people out there, walking the same path with them would be huge. Really, it would be really huge for these families.
And I think it's really important to recognize the fact that those of us who have opportunities to be able to speak about our experiences do not represent the totality of the community. And there's many who just don't have the support system that some of us have, and they don't have the options. But so that was one of the reasons why I said it's really important, if you can avoid taking this journey alone, to find your person, whoever that person is, and bring them along, let them learn with you. And the assessment is, we know that mental health has many different responses. Just the conversation around mental health has many responses in the community. But I think it's important to address the elephant in the room. And it doesn't always have to be called mental health. It could be emotional wellness, right? Which is a term that I oftentimes use, because we all want to be emotionally well. We all want to be able to process the feelings that we have, good or bad. And so I think just being able to create safe spaces for those types of dialogues where people don't have to feel judged. They don't have to feel like, every note that people are taking is going into their chart and it's going to stick with them for the rest of their life. One of the things that I really pushed back against with the social worker that came to see my son is, when you ask, have you ever thought of death? And I said, excuse me, pretty much every person with sickle cell has thought of death. That's an unfair question, right? And so I said, maybe we can reframe that question, right? And even ideation like that. When you have a disease like sickle cell, it is not uncommon. Thoughts and actions, and I understand it's a very thin line, but what we don't want to do is to create a fear of people opening up, talking about what's really happening inside of them. And so we have to be mindful of how we create spaces to have those conversations.
Yeah, absolutely. Absolutely right.
I love that you shared that, because chosen family is important, just as well as your biological family. I will share this personal story, which is, during my fertility preservation process, my family was not on my side. They wanted me to just be healthy and well. So they were like, absolutely not. You're not preserving any fertility. Go ahead and start this protocol. And I said, it's my body. It's my choice. I'm not starting until I preserve my fertility. Didn't know I was going to find the money, but I found my aunt and a really good friend of mine who struggled with conceiving be my support system during that journey. And even though apologies have been made now, and it's family, you love them still, that is a facet of my journey that remembering it is filled with a lot of guilt, because the people I do this provided the most couldn't. And so I really want to highlight and emphasize what we were saying, of that family can be worth It doesn't always have to be the traditional version of mother, father, siblings. You can have a coworker or a colleague, a classmate from school who is willing to and open to learning and supporting you through this process. And so not all support systems for each patient is going to look exactly alike. So I just want for us to kind of be very, very cognizant and aware and mindful of that as well.
And Wumi, we have just the opposite. My son was not interested in doing any fertility preservation. And I'm like, listen, the way you feel today may not be the way you feel down the road. Let him. And I think it was more of the process of it as a male that he was like, yeah, no, I'm good. And so like, we have very frank conversations. So I'm like, listen, is this what you're afraid of? And I just put it out there. And
The men have it so much easier when it comes to fertility preservation.
They may not feel that way, but I agree.
I would say I wasn't interested either.
Invasive, let's say. They have a little more privacy, but for him, you know, he so hated sickle cell and the thought of having sickle cell. And what we didn't talk about is the germline. But I really wanted him to make it clear to him that you are going through an evolution and that you may feel different down the road. At least give yourself a chance to make that decision. Don't take that decision away from yourself. And so, you know, through lots of coaching and discussions, he did move forward with that. But those are delicate topics. And, you know, people have varying feelings on it. We fight very hard to make sure that manufacturers and insurance is including fertility preservation, because that's fertility justice. And so whether people choose to move in that direction or not, it should be made available, and it should be little to no cost like it is in other disease states.
This has been, wow is not the word, phenomenal, moving, emotional, celebratory for each and every one of you. I want to move back though. So I'm feeling something, and that is, I think it was when you were being, Yomi, when you were being very honest about your journey. And what came to my mind was Bobby, age 18. One of my first patients who he said he was done at 18. And so he allowed his body to atrophy, and that was it. And so I always will remember him. And you were 25, and some people are younger, some people are older. And so it comes to mind. And I think how blessed you guys are, because the science is here. But I still think about Bobby and being 18 and not having lived his life because he was tired of being called outside of his name and not getting what he needed. And this is still what's happening right now, today, this moment, this second, that somebody is struggling. So that's why I said it's emotional what you guys went through. It's emotional for us, the audience. There are people who are listening who are thinking, is this for me? And you guys were very raw. And I'm using that word raw on the inside, raw in terms of your feelings, because you had to make a decision. And it's not an easy one, but it certainly is life-changing. And you all are very, very, very blessed. And those who are coming after you. And I'm Dr. Wayne. Thank you for coming to my office and saying, can we? You knew I was going to say yes, but yes, this is what we do, we educate. Thank you, Wunmi, for saying, for allowing you to orchestrate. I couldn't have done any better. You all were excellent. You all have processed this, and I'm sure that you still are processing it. And that's why I'm saying it's very raw, emotional. And then for those who have, quote, aged out, I don't like using that word, but it's real. It's real. And but there's still hope, everyone, because even as we speak, um, they're thinking of a way. They're trying to come up with a way of not even having to use chemotherapy. Okay, even as we speak. So there's hope. And if you're listening, and we know that you've gone through the storm, um, mental health, seeing a counselor, speaking with someone, please do it. Um, it's available. I tell people here in California, you're not in the in crowd unless you're actually speaking with the therapist. Do it. It's okay. It's emotional wellness, like Ray said. I encourage you all to do it. I like what Ray said as well, or the question I think from Brianna. I want to say about caregivers and their emotional wellness as well. Are they ready? Um, wow, it's a lot. I think I did want to read a couple of comments, and I think Pat stated a couple of them. One was she said, uh, "Thanks for sharing the good, the bad, and the hope for life and its abundance." That this was so helpful. But the next one is maybe we should reconsider mental health. I really want to push that again and dialogue with caregivers because as they help make decisions about buying in, they also suffer remorse if optimal outcomes are not achieved. You know, this is about gene therapy, but I have to say this also is about mental health.
It's about how you support your warrior.
Thank you. Definitely. So I think at this time, we're definitely going to do this again, guaranteed. And
May
at
I
this,
say one quick thing?
oh, sure.
Yes, I just wanted to say you spoke on our warriors that have passed on, and I felt like when I got accepted into this program, it would have been a slap in the face to not accept it, seeing as all of my sickle cell friends that I'd known that had passed away before me, they would have jumped at the chance. And I knew that they were not here to take part and to benefit from this. So what I did was I brought them with me to my first stem cell collection. We had a shirt made that has all their names on the back of it. And so for me, that was my way of bringing them into the new science with me. That was my way of not letting their names be forgotten. That was my way of letting them see what was happening and the transformation that was about to take place. Even though their earthly bodies may not have been here, nobody on earth had forgotten about them. And if anybody wasn't going to take them with me, I was. So they were going to be a part of my process and a part of my story no matter what. So that was my little nugget of was something I did for me and for them. I brought them with me. So we do not forget our fallen warriors.
And I'm sorry, I do want to add one other thing that I want to highlight that Yomi said was that she was able to hear all the things that people were able to accomplish after the trial and after receiving gene therapy. And that was something that I held, and I created a vision board. And a lot of this, my doctor said, he was like, my doctor and the psychiatrist that they gave me, they said, you know, you're going to have to focus on the after, the vision of what you're able to accomplish to even get through this. And so I created a vision board, and I held on to that, and I had it in my hospital room. And I was like, all right, these are the things that I hope to accomplish once I'm on the other side of this. So it's very important to have something that's going to continue to give you hope. And I think that we heard that today.
I called mine a suck it list, not a bucket list, but a suck it list. So suck it, sickle cell. This is my list of all the things I'm going to accomplish. Not my bucket list, my suck it list.
Well, why don't we do this, everyone? We're wrapping up, and so let me, as I call your name, if you guys can wrap up, and then we'll end with Dr. Wang. So, Ray.
Yeah.
Final words?
Yeah, I appreciate that you have included the caregiver while the focus is indeed as it should be. The warrior is at the center of it. We're on that ship with you. And even if we don't always talk about the feelings that we have going on inside, they exist. Even when we're trying to be strong for you all. But I just appreciate you all's transparency and so much more of this. I can't wait to see.
Thanks, Ray. Valerie?
I'm so grateful for the opportunity to share my story, to share my testimony in this, and I'm open to speaking about this again if you have another one. But this has been truly a transformation for me, and I'm just so blessed to be on the other side of it.
Yomi?
Thank you all for the opportunity. I really do appreciate this. And I really love sessions like this because there are a lot of misconceptions about bone marrow transplant, about gene therapy. And these sessions really do help educate not only sickle cell patients, but also caregivers, family members, or even those who are just curious to know, because there are a lot of rumors flying around, and these do help a lot, a lot, a lot. This is something that I wish I had 2 years ago when I was contemplating what I should do. And I'm always grateful to be on the other side and cannot wait to see more warriors get to that other side as well.
Taylor?
I would like to start off by saying, well, I would like to end by saying, ladies, Yomi, Val, Wumi, I am especially proud of all of us because not only are we trailblazers in the fact that we went through these treatments without, knowing that much about them, we did our due diligence, but we took a step on a path where nobody really had a flashlight shining down it, and we trusted God in ourselves, and we kept pushing. And not only did we just keep pushing for ourselves and then just go off and live our own lives and be like, okay, well, forget everybody else. No, the four of us are still here, reaching back and pulling up others with us. So I am proud of us. If nobody else says so, I am proud of us. We did a dang good job. And we are some beautiful women, some very powerful Black women.
Wunmi?
I think my final words are call to action. And Dr. Rowley, I'll start this off with you, which is we are more than our stories. It's also about creating resources and spaces for us as well. No CBO organization has done that yet, of creating a space for us. And so I'm posing to you that at the next conference, I would like to see more than a share your story and putting words and action behind those words to say Kyan Wellness is now creating a space for cell and gene therapy recipients to not only bond and their caregivers to not only commune, but also giving us resources to be able to continue to thrive on the other side of sickle cell as we continue to navigate life itself. But my final words are really to, and Ray is already doing this, I'm not going to call Ray out, but Valerie, Yomi, and Taylor, I really want to, again, celebrate your story of victory. But Chris Landy walked so I could run. I ran so you could fly. And so I'm posing the responsibility on you three ladies to champion those that will come after us, regardless of age. Because I think our lived experiences should be the blueprint for everyone else that comes after us. And so I'm challenging you ladies that, like, outside of sharing your stories, and forums like this are important, we need initiatives for us. There is nothing for us without us. Dr. Bailey says that repetitively. And I really want to champion each and every one of you that, like, the work doesn't stop because you're on the other side of sickle cell. What it means is for those fallen warriors, we continue the work. The legacies they created, we continue to kind of carry the torch and keep thriving and doing. But also, I think, recognize that the gift we have might not be a reality for other warriors. And so it's our job to caregive for them in the way our caregivers gave to us. And so I really want to leave that last note because I really do think forums like this are great to share stories, but I don't like words without action. And there's so many things, there's so many gaps that still exist in cell and gene therapy today that we have to actively collaborate and work together to fill so that the younger generation, we're breaking boundaries and glass ceilings that were put that we had to suffer through, but they shouldn't have to. So
Thank you. And I accept your call to action. on behalf of Cayenne Wellness Center. So,
I
Dr.
accept your call to action as well.
Minnesota is in there.
Hey. So, Dr. Wang, we're going to end with you. You began this, you reached out, we made it happen, they made it happen, the community made it happen. So, I'd like to have you have the final words, and then if everyone can hang out for a second after.
Okay. Well, first of all, I absolutely need to thank you again, Dr. Rowley, for meeting me in your office and saying yes to this idea. It grew very quickly into something really beyond what I had even imagined, and really, I can't say more beyond that. Today was perfect. It's such a valuable resource to be able to hear these stories from these beautiful, powerful women. And I really do hope that we continue to do this. I do want to thank all of the patients and their families who participated in the clinical trial, really, who put their faith in the medical system and underwent a completely untested therapies to see if science could make everyone's lives a little bit better. And I also want to thank the patients and families who every day are putting their trust in us to offer these therapies for all of you. And again, thank you to all of the panelists for sharing your very powerful stories today. And I really do hope to be continuing to work with you on efforts after this.
So, with that, we're saying thank you all for having joined us for these last, can you believe it? It's been 2 hours already. That kind of went quick. I'm Dr. Carolyn Rowley from Executive Director at Cayenne Wellness Center. We thank you for joining us. Of course, this is available. All of our educational platforms and what we provide is recorded. So you'll be able to come back and listen and share. So with that, have a great rest of your Thankful Thursday, and we'll see you next time.